My name is Candace and I received a medical diagnosis of sign scleroderma. It is my sincere quest to inform others what can happen in the medical system today. I wanted to do a video for parents, children, and patients, making sure the general public at large is educated. There are 7,000 different rare diseases. About 50% affected are children and 80% of rare diseases are genetic. What is scleroderma? It confuses the best of the medical field, making it difficult to diagnose. September 11th of 1980, I'm 5 years old. It's stating in my medical record that I'm a well-nourished child who is irritable, somewhat larger than the average child, and the patient doesn't cooperate well. The child appears to be alert, although she cries easily. At 6 years old, it is stating that I have severe abdominal pain. I have a cough for 7 weeks, bronchitis. I have a fever of 103, wheezing, congestion, acute laryngitis, and admitted to the hospital. And that was my childhood. On September 3rd of 2013, I was tested for an ANA antibodies. It came out positive for scleroderma. 3 months later, I saw a doctor on January 14th of 2014 for the Center of Rheumatic Disease. And he is stating that I had abdominal pain and 2 anxiety, and that's what he diagnosed me with. And you can see on the chart, there's no name, date, doctor, or time, or age. At St. Luke's Northland Hospital on October 15th of 1994, I'm 19 years old, still with the allure, abdominal pain, and urgency frequency, and here's my medical record number. And as you can see on the patient label, it is stating 10/15 of 1994. Over here, it's stating that my signature is missing over here and the times on this emergency department transition record. I have the record here showing that the exact abdominal pain and the patient signature is missing. And as you can see, the patient label is not showing. Here is the discharge instructions that they sent me when I inquired about getting my medical records. They sent this to me on a CD. And as you can see, that this record does not match. There is now my signature. There is a date and there's time on here, right before midnight. And here you can see on the patient label doesn't match. It's showing the patient. So now you can see that they have actually forged my signature on consent forms. January 31st of 2019, there's an Ann Romaker physician that is stating she ordered me an ANA antibodies test with no referring physician. There's also a second one that says Bill VP, and they both have diagnosis codes. It is showing that my name is now Candace L.H. Schwamm at the bottom here. They also used a anesthesia code, which is 42738, and you can see it's at the top of here for St. Luke's Physician Partners, and it says Kent A. Houston actually ordered my ANA, and it says because of a billable diagnosis code of pain in the joints, although he diagnosed me with just abdominal pain and anxiety. Here it is showing that the ordering provider was Ann Romaker, services for Candace L.H. Schwamm. It says the patient information, and now it says Candace L.H. Schwamm still. You can see there's a dark line here, and this says it's coming from the default account, and there's a line going down. This is on January 30th of 2019. And on January 31st of 2019, I received this from Midwest Pulmonary, Dr. Ann Romaker's office. You can see that these two don't match, the dates and the times don't match. I've never seen Dr. Ann Romaker, and it's stating here that after our discussion that she started looking in to find my chart, whether it was an actual chart or electronic. And the email states, since you were seen in 2014, your chart would have been scanned into an electronic record by Dr. Ann Romaker's office before we received them. I've looked in electronic files in the storage log that she gave us, that she left, and I'm not finding that we ever received your records from Dr. Ann Romaker. I do apologize. That's because I've never seen that doctor before. I've never seen a pulmonologist in Kansas City. So now I have all this documentation that I've not felt well throughout my childhood, and I have now been diagnosed with a rare illness, and I have asked for an evaluation on my son. It's stating on September 11th of 2013, mother stated she recently been diagnosed with CREST syndrome. She informed the staff she was recently diagnosed with CREST syndrome and certain her son has it as well. And as you can see, there are red line markouts. It's also stating that difficult case of abdominal pain, limited of diet by parent, and resulting in failure to thrive, likely due to the calories and food types. It says growth was normal up to 1.5 years ago, continues to gain in height. Mother says she was told of CREST syndrome and now wants her son evaluated. How can he be continuing in height, but it says the growth was normal? Mom's primary concern for Billy's history of abdominal pain could represent an undiagnosed autoimmune disease. Billy seems more fatigued than previously, GI issues, and one episode of tingling in his calves. He passed out when overheated, and occasional burning on urination. Billy's history and physical exam are not concerning for systemic autoimmune disease. Because Billy does not have any symptoms consistent with rheumatic disease, I would not recommend doing any laboratory workup, including an ANA. The third doctor at Children's Mercy Hospital, disregarding my son's symptoms, he now is diagnosed with an eye infection, and it says the course is progressing as expected. It says family upset during visit due to nurse practitioner not ordering labs because the patient isn't having symptoms at this time. My son was seen from 2009 to 2014 at Children's Mercy Hospital with symptoms during that whole time with the same symptoms and being disregarded. So I made a phone call to the patient advocate at the hospital and I made a complaint against Dr. Stephanie Page, the gastroenterologist. So then they ordered a test and it says diagnosis unknown, and you can see that they didn't even check my son into Children's Mercy Hospital, according to the patient appointment summary report that was printed out on March 24th of 2014. The result from the January 21st, 2014 blood test, it is stating that the result was done at the Mayo Clinic and the test result was done also at Children's Mercy Lab. But the test that they ordered from the Mayo Clinic doesn't match up to the one that they ordered at Children's Mercy. Here it's stating that I saw Ann Romaker, who's a pulmonologist, and it says down here the second specimen was a $ bill VP. And there's actually two accounts down here, but this account was nowhere to be found. This matches up to my son's account where it has a $, it says citromere antibodies on the patient summary report and the orders from Children's Mercy Hospital. There was a CD that was entered into court, and these were the orders that was on there. That matches my medical record. Mindy Schneider states that Billy doesn't have CREST syndrome like the mother claims, that the rheumatologist did testing and found nothing. Billy doesn't have the symptoms. So on January 30th of 2014, Jason Chapman and Officer Baker and Carpenter were banging on my door. I called 911. The 911 caller told me that I had to open the door. After I saw out an advice of an attorney, he said I should not have opened the door, and I don't have to open the door just because the 911 caller told me that I was supposed to, because the police were on the other side with a social worker. Now, I got a letter on May 30th of 2014, which was 4 months later, stating why I couldn't get that 911 call. They are stating that they have been advised by the communications unit that due to technical issues with our system, that the call is not retrievable. My son at the time was also going at Pathfinder Elementary in Platte County. Dr. Dahl was the principal, and Dr. Dahl actually had a conversation with me about my son, which he was totally inappropriate, and his son was bullying my son all year. And the communication that I had with him ended up in my son's medical records. Some of the emails that I had with both of the teachers ended up twisted around and fabricated into the social work paperwork and my son's medical records at Children's Mercy Hospital. March 3rd of 2014 petition. It is stating the mother has misrepresented or purposely made up symptoms for the child in an attempt to instigate medical evaluations and treatments. The medical professionals at Children's Mercy Hospital have diagnosed this as medical child abuse. The case type is FC abuse and neglect. The security level was 4. It says filing probable cause, and it says right here, child taken. And when they say child taken, that's what they mean. I stated to the court that I've never missed a medical appointment, not one time. And the court states, nobody says you have. Jason Chapman is stating to me that he was at my home because of a concern that Billy missed a scheduled medical appointment on January 30th of 2014 at 5:55 p.m. Over here, the hospital is stating they're going to remove my child from me and they're going to do an inpatient study on him to introduce him to foods to see if he has any intolerance, because he's already completed allergy testing and he's found to not have any allergies. 75% of children removed by C.P.S. was based on no evidence. Falsification of medical records of any kind of alteration or destruction is considered tampering with evidence in a medical malpractice case. False documentation is the process of creating documents which record fictitious events. That documents can be used to prove that the fictional events happened. And forgery is a crime in all jurisdictions. Jason Chapman is the social worker that showed up at my house with police. Ben Kaufman is the social worker that has custody of my child to tell the doctors what they can and cannot do to my child. Here's the circuit manager at Children's Division, Sally West, and here's Angie Todd. She was part of the case as well. This is stating that Jason Chapman sent to Mindy Schneider on March 7th that there was an investigation and that they found it substantiated. So on March 7th of 2014, I received that the determination was sexual abuse. I also found on my son's medical record on January 15th of 2014 that an outpatient nurse note stated that I was casually mentioned that I was molested as a child and that everything that was wrong with my child is now happening to her son. Now, on that same day, you can see that it says on January 15th of 2014 that the doctor is missing. But over here, when I had the patient summary report printed out several months prior, it is stating that Casey William actually saw my son on that day, but now it is missing. Now, I have asked in writing and verbally why they have put sexual abuse on this. It says that you have verbally asked in writing and to receive a letter explaining why this has occurred, as I indicated you on the phone that the worker made an error in his wording on the form and the supervisor did not catch the error. As Sally West is handing me this letter, she stated to me in the social service building that I cannot sue her for this. A medical diagnosis is the process of determining which disease or condition explains a person's symptoms and signs. So I'm going to use my medical records and my son's medical records that we had seen by medical professionals, the transcript from family court and social service documents, and third-party application testing to show medical fraud and medical diagnosis is covered up. On my case, it's impersonating a physician on my son and I's medical record, social worker, and forged inpatient consent forms. On March 6th, I lost custody and rights to Children's Mercy Hospital in Kansas City, Missouri. Dr. Emily Kylo, who's a child abuse expert, wrote the consult. The diagnosis was allegedly failure to thrive, based on looking at a growth chart. March 1st of 2014 is when they stated that I was a no-show, prearranged from a old account by Dr. Stephanie Page. On January 20th, I made an advocate phone call. And on January 24th of 2014, I went down to the hospital and I had a patient appointment summary report printed out. And as you can see, it is stating over here that the gastroenterology clinic with Dr. Stephanie Page, that there was a confirmed pre-clinic appointment and it has an account. This means that this account was pre-done on January 24th, before the social worker comes to my house on January 30th. This same account ends up being the account that they used for a no-show, and it says that the discharge was 3/1 of 2014, Dr. Stephanie Page. Now we have, under my May 20th of 2004 medical record of St. Luke's Hospital, they entered a system ID on January 29th of 2007, which my son and I weren't even living in the state at that time, with this medical record number. And this medical record number and this medical record number. So now there's 3 different medical record numbers. I have now found that the description was a SNOMED code under my problem list at St. Luke's Hospital. That SNOME code also matches up to the SNOME code that was found in my son's medical record at Children's Mercy Hospital, stating it acknowledges a disease process. Here it's showing at St. Luke's Hospital on 2/1 of 2009 of my son that there was an RN named Deborah that went in and changed my son's medical records, and the diagnosis is missing. And as you can see, they forged my signature and the phone number is missing above. There is no date or time on the patient label. Over here, there's also a Deborah that went into my medical record in 2004 and changed that my date of service was on March 1st of 2014. It's also showing here on my 2010 medical record that I had a date of service on March 1st of 2014 as well. So now we have Children's Mercy Hospital, a prearranged appointment that they're saying I didn't show up on March 1st of 2014, but it's just a discharge date by Dr. Stephanie Page. That same exact date, someone is electronically signed in and saying that the discharge summaries from that date came from my medical record at St. Luke's Hospital. It says March 1st of 2014 on my 2010 medical record. It's also stating that the discharge time was 23:59. Over here on my medical record at the University of Kansas Hospital, the time matches up to St. Luke's, which is 23:59. Here's my medical record number. It says 23:59. There's no staff initials or staff nurse. It's also stating over here that I was an outpatient when I was not. So here it is stating that the claim type is medical. And as you can see, it says attending physician, and the attending physician is missing now. But if you go over here, the same attending dates and time, the physician is all the same. But right here on 10/29 of 2012, it is stating that the claim type is outpatient, but over here you can see very small, it says I, and it says 9 different times she puts in that he was an inpatient when he was not. Over here it is stating 2 dental patient numbers, DPN, under capitation claim. And as you can see, the attending physicians are missing again, the procedure codes are missing, but it says on March 1st of 2014, on a day that my son and I were not seen, but there is now a paid service through Medicaid 6 different times. It's also showing here that my son saw the rheumatologist during an inpatient stay in 2013, which my son was not an inpatient at that time. So on all of the orders, there were 32 orders, Children's Mercy orders on his medical record. It is showing that the discharge dates are all different, but the discharge times are all the same. It says 23:59 on all of them that match up to my medical records at St. Luke's and my son's medical records at St. Luke's. Here it is stating in 2004, 23:59. This is my medical record with the notes missing. It is also showing here the discharge time at my son's at St. Luke's. It is saying 23:59 in 2009. It's also stating the patient record was merged with a duplicate patient record. This can cause discrepancies in the audit trail for which the actions were recorded prior to the merge. So right here it says 23:59 Dr. Stephanie Page on 3/11 of 2014 when my son was in state custody. So now it is stating that my son's medical record was merged with a duplicate patient record, which was mine. Here I'm 29 years old in 2004 before I even have my son, and it's saying I was discharged at 23:59. My son is 2 years old, and it's saying in 2009 he was discharged on 23:59, at the time 23:59, which matches up to the 23:59 in state care with Dr. Stephanie Page at Children's Mercy Hospital. So now we know that Dr. Page is stating I didn't show up to a no-show on March 1st of 2014. They electronically sign in. They give me 2 different medical record numbers on my 2004 and 2010 medical record. They also electronically sign on my son's medical record at St. Luke's Hospital when he was seen in the clinic. And it says that he was seen on March 1st of 2014. So now we've established that the day I didn't show up, which was Actually, January 30th of 2014 is when the social worker and police came to my home. But on his medical record, it says March 1st of 2014. That at a totally different hospital, they changed my son and I record, stating that we were seen on March 1st of 2014. Here it's stating my positive ANA at St. Luke's Health System, and the time matches up to the times of my son's laboratory work, but it doesn't say what lab they actually created. It's also stating here under my son's medical record that Dr. Burrows placed my son's ear tubes in for chronic recurrent ear infections, and he was also seen by Dr. Rouse in Liberty, and that the tonsils and adenoids were normal. Here's my medical record from St. Luke's Hospital and my son's medical record number. And as you can see that they created a document, it's stating on May 12th of 2011 at 0117 time. They created on that exact time on my son's medical record, May 12th of 2011 at 0117 time. My son and I were not seen on that day. It's also stating that on this record that my son had a mild prominence of piloharlar interstitial markings, which they told me that he just had ear infections and they gave us antibiotic and we went home on that day. It's also showing that they created a document to the present day on both my son's medical record and my medical record at St. Luke's Hospital. It is showing here that there's a corporate number here that now they changed to my son's medical record number. And right here is actually my son's medical record number. And it's stating that my son saw Vance Jernstrom in 2009 for recurrent ear infections. These are the 2 times that my son was seen by Dr. Vance Jernstrom, where he actually referred my son to an ENT specialist at KU Medical Center. And it says KU Medical Center here. And it says now history of present illness, and it says recurrent ear infections. Now this is 2 clinic visits, and it states that they were done in 2009, but right above it, it says the date of service was March 1st of 2014 on both dates of service that were done in 2009. It's showing here that on the billing that my son had a clinic visit that they turned the facility charge to an urgent, but my son actually was just seen in the clinic visit at St. Luke's Northland Berry Road. Here it's stating that my son saw a social worker named Catherine Kaufman. I inquired to see if she was a social worker, and it's stating that they do not have a clinical social worker at the Missouri Division of Professional Registration. I also inquired if she was a doctor. She is not a doctor nor a nurse at St. Luke's Northland Berry Road, but here a Catherine Kaufman is on my son's billing record at St. Luke's Northland Berry Road. I made a complaint with the Office of Civil Rights stating that I didn't receive all my medical records or my son's medical records from St. Luke's Health System. So then they sent me more billing records that is showing that the total charges were 0 here and the payments were 0 down here. 0 and 0. This actually showing that they match up to Children's Mercy medical records. Here is my forged signature in 2009. On 4 different times, my son went to the ER for ear infections. And as you can see, that the signature here does, all 4 of them don't match. And it's missing at the top here for it to say Billy, and the date is missing. That my signature was forged on consent forms with my son's name missing on it, with no date or time on the patient label. Here it's showing on my consent of agreement for healthcare for my son. There's a 3 on this one, and the 3 is missing on this one, and there's no date or time on the patient label. Here's a blank emergency nursing record physician order sheet that is missing a date with additional nursing notes. It's all blank. Over here, this is a blank emergency nursing record physician order sheet that's missing the date, but it has a physician signature at the bottom. Now, here are physician records that is missing dates of service on all of them. And the dates of service are not on the patient label from St. Luke's Hospital. Here it is showing that my son had a fever, right ear pain, and redness in the left ear and right ear pain. And this is stating that this was a respiratory reassessment, and the bottom of this diagnosis is blank from St. Luke's Hospital. These are my son's when he was seen in the emergency room, you could see the flow sheets are blank, they're missing. And it says MAR audit report. It is saying that the visit has been closed and the record of the med list at the time of the visit is not available. There's no care plan information. That it says that the regular font are the most recent information and it's been revised and modified per the bold font. So this means that there's missing records from St. Luke's. This is also stating that all 4 times that my son was seen in the emergency room, that he was discharged at 23:59 on each of these days, right before midnight. And as you can see here, that there's a diagnosis missing on all 3 of these. And the diagnosis at the 4th emergency date, it says ear infection. Here it's missing the phone number on both of these documents, and my signature was forged on all 4 of these, which I have never seen these documents before. Now it's stating Keith Mann stated, after being seen by both rheumatology and allergy immunology and undergoing intensive allergy testing, it was determined that there were no signs and symptoms of underlying rheumatologic or allergic concerns. Despite reassurance from these subspecialties, his mother persisted to find a diagnosis within these subspecialties. And it says chief complaint, failure to thrive. They actually is stating that they used a hospital outside of CMH for 5 days, which they never told us. It's also stating that they used a 13-year-old growth and development grid when my son was 7. Here are all the doctors, main people that my son had seen through his time of 2009 to 2014 at Children's Mercy Hospital. Here's Dr. Stephanie Page, who made the hotline call on me, who referred me to Dr. Wilkerson and Dr. Kessler with this social worker in the room, not Mindy Schneider. Mindy Schneider is claiming that she has seen my son and I in a clinic setting, and she never has because she actually works in the emergency room department, and I've never seen her before. This is Dr. Emily Kylo, who made the consult for child abuse against me. Here is a dentist, Dr. Ferguson, which my son has never seen a dentist at Children's Mercy. This is stating that on 12/29 of 2012 that the patient has GI issue complaints. It says Billy is being followed by GI with normal testing to date. Mother recently had gallbladder removed after several other surgeries from abdominal pain and feels that he is suffering just like she did all her life. And it says here that they didn't even check him into the emergency room on this day. It's stating while my son is in state care, here is the GI letter from Dr. Page. She is stating that his IgA level was noticeably low at 9.9. Without my knowledge, he was seen in the surgery clinic and his gallbladder was removed on January 18th of 2013. His diet at the time included brown rice, organic vegetables, fruit, turkey, chicken, pumpkin seeds, and sunflower butter. He was also seen by rheumatology in September for persistent abdominal pain. Dr. Page on March 11th of 2014. Subsequently, Mom demanded testing for CREST syndrome, which was done via Mara Becker at a patient advocate discussion. His labs were negative for CREST syndrome. He reports that dairy products tend to bother his stomach. He reports that his abdominal pain was periumbilical in location. So, being out of my custody, he is actually stating what bothers his stomach and where the pain actually is. So, I don't have Munchausen by proxy. Keith Mann. His mother persisted to seek a rheumatologic allergic diagnosis for his reported symptoms. As you can see here, it says orders placed. It says GI clinic orders. It says Dr. Stephanie Page. And it says modify. And it says height and weight. She does it on 1, 2, 3, 4, 5, 6 different times. She modifies his height and weight. She also states, Mom's convinced it's his gallbladder. Please evaluate. When my son had the testing done. As you can see here, it says low Ig levels at 9.9 right here, his immune system, and it's Dr. Page ordered it. She also ordered a ultrasound, which came out normal. She also ordered a gallbladder scan, which is showing that the ejection fraction was 36% and ejection rate means abnormal is 35%. And that does not include an obstructed common bile duct, which my son actually had. So here you can see that on the other claims where my son was not an inpatient, but it says Missouri inpatient, and it says in 2012, where she's ordering labs that aren't even in my son's medical record that they entered into court. There is no IgD and IgG and IgM level. The blood laboratory work is missing. 10 warning signs of a primary immune deficiency is 4 more ear infections within a year, antibiotics with little effect, and persistent thrush in the mouth. You can also, from having a primary immune deficiency, you can have allergic reactions to foods. You can have autoimmune neurological disorders, and you can have continued respiratory and sinus ear infections. Also, you can have impaired bile flow that causes jaundice, which is associated with scleroderma and Crest syndrome. CD custody via protective custody hearing on Thursday, 3/6 of 2014. Notarized letter, the Missouri Division of Social Services confirming that the patient is a ward of the court. Mindy Schneider, who knows the patient well, has worked closely with the scan clinic for concerns of medical child abuse. Well, we've never been seen in the scan clinic, and I've never met Mindy Schneider. Here it's stating that Ben Kaufman is a caseworker, and he has got my son's complete medical record on March 6 of 2014. My son was not entered into the inpatient stay until March 11th through the 15th of 2014. So how could he have my son's complete health record? They subpoenaed the medical records just from Children's Mercy Hospital on April 10th of 2014. It is stating over here that Dr. Keith Mann is stating that he's custody with the worker of Ben Kaufman, and I'm to have no contact by phone or person. And Kaufman requests that the discharge instructions be faxed to him. It's also stating here that the Missouri Department of Social Services stated I needed a psychological evaluation. It is showing that it was faxed to Ben Kaufman. And regarding me, Candace Schwam, is stating that I was diagnosed with adjustment disorder with mixed features. It's also stating over here that please contact Children's Division worker for any medical consents needed. Mindy Schneider, who knows the family well and has worked closely with the scan clinic. We have never been there. On a Children's Mercy medical record of my son's, it's stating that we both saw a social worker named Stephen, and I'm not quite sure on how to say the last name, but it's Bigjiga, and it says page 1 of 1 copy, and it says Children's Mercy is missing at the bottom of this medical record. And it's stating that he gave me a safety screen points of a 5, and it says safety concern no, but then he gave me a screening point of a 5. I made a complaint on December 20th of 2016, investigations unit in Jefferson City, and they wrote back because I stated that my son and I had never seen a social worker by that name at Children's Mercy Hospital. They returned my complaint stating that he was never employed as a social worker at Children's Mercy Hospital, and he is not licensed in the state of Missouri as a social worker. So as I called Children's Mercy Hospital, they stated that he works at the registration on the weekends at Children's Mercy Hospital. He's not a social worker. And then they told me that he works in the admitting department during the weekdays at St. Luke's Hospital. So he is not a social worker, although they put him as a social worker at Children's Mercy Hospital on my son's medical record. Here's when my son had his ear tubes removed. Here's my son getting tested for his gallbladder. Here he is having his gallbladder surgery. I stated that he was allergic to latex, although they said that he was not. And as you can see, it's very red here that they went ahead and put a latex Band-Aid on his stomach when obviously it's red and he does have an allergy. Here he is being looked at for his ears because he still has holes in them. Here he is when he was removed from my custody on March 6th. As you can see, he looks beautiful, wonderful. His skin looks great. He is smiling. And then after he gets out of the hospital as an inpatient, his face is swollen, like he's been drugged and had anesthesia like he did when he had his gallbladder removed. On April 12th of 2014, this is what he looked like after they stated that I had my custody removed, and because of the Children's Mercy records that were entered into court on April 10th that were subpoenaed. Here's my son where he has a little bit of a bone growth on the left side, and he has been hit with a ball sometimes when he's playing, and it can become bruised. The evidence that was entered into court against me was from Children's Mercy medical records here and Dr. Kylo's consult note. And I had a state attorney, which the state is trying to take my child from me. So when you have the state attorney, she just used 2 medical records out of the 1,100. The social worker from Children's Division stated, this is the transcript. You have been the worker assigned to the matter involving Billy Hunter Barami. Yes, I have. And in connection with that, you have conducted an investigation into the matter. He says, yes, I have. And that's including your review of the medical records from Children's Mercy Hospital in the connection with this. He says, yes. Mr. Chapman, does your report state that the natural mother appears to love and care for her son? Yes, it does. And does she has proper mental faculties to take care of her son? To the best that I can determine, yes. Do you have any evidence to the contrary? Just the documentation from the professionals at Children's Mercy. And you have been given information from doctors at Children's Mercy because that she has put him on a limited diet, that this has placed him in harm's way. The reports that were provided to me, all there in the court document. All I can state, if I have the reports that were provided from the hospital. Mr. Chapman, as part of the diagnosis at Children's Mercy Hospital, they have in fact informed you that the opinion of the mother that misrepresented or has purposely made up symptoms for the child in an effort to instigate medical evaluation and treatment. Is that correct? He says yes. And that is not done in good faith according to the doctors. It was done purposely and for misrepresentation. He says yes. The court stated that Ben Kaufman, who's got the custody, isn't testifying. That Dr. Emily Kylo, she's sworn in because she's the medical child abuse expert from Children's Mercy Hospital. And this is the transcript from family court. Dr. Kylo stated she went through his entire medical record and she put a summary together. My attorney, I asked what specific statements of the mom that the doctor observed that misrepresented symptoms. She states she was non-responsive. And the medical records are here on the CD. So here is the CD. Here are the 2 files that are on the CD. This file you cannot open. It's password protected. Actually, that password protected file has 500 more medical records on it that they actually entered into court that you could open and you could see. I put an arrow here on the Image Now documents because those are where my forged signature is on those consent forms for dental treatment. Here is an underscore on some of the medical records. So that means that if there's an underscore, that there's more records that they didn't disclose when they entered all that CD into court. So here it says the transcript. Dr. Kylo stated that she used a growth chart for Billy's failure to thrive diagnosis. The only chart that was showing his height and weight was from July 2nd of 2010. On July 2nd of 2010, they're saying that my son saw Laura B. Ross. And over here on the patient summary, they removed the doctor that my son actually seen because he did not see a Laura B. Ross. It's also showing a sticker on that day. It says July 2nd of 2010, although it's showing that I filled this document out on June 2nd of 2010. So these dates don't match up. I also inquired with the company that it's stating that it's orange, black, and white over here. And that's company standards. That's illegal standards of how a hospital is supposed to use this application. And as you can see, that Children's Mercy did not use the application correctly. So it's illegal how they did it. It's also showing that if you use this PEDS online, that you can customize any kind of medical records and you can integrate old medical records with new medical records. Dr. Kahlo states on March 17th of 2014 that when she's asked to do a consult, that I look at every single piece of medical record that we have in our system and I review every single document. So she must have seen on the CD that my son on March 26th, July 18th, and November 12th of 2013, that there was a doctor, and it says provider name RVWZZ pending. At the bottom, the electronic date and time are missing on it. So then I made a complaint with the Medical Board of Healing Arts and stated that RVZZ pending isn't a name of a physician that my son has seen. And they stated that that doctor does not exist in Missouri, and there's never been a doctor with that name that has had a medical license in the state of Missouri. On February 25th of 2014, that there's a faxed referral to the juvenile office. The following day, somebody went in my son's medical record and updated on February 26th of 2014 his onset date of his diagnosis. Here it states that my son was failure to thrive, abdominal pain cause unknown, on an ENT record. It is stating that my son still has holes in his ears on 11/21 of 2013. These are all medical records from 11/21 of 2013. It is stating he's failure to thrive. It now has that fake provider name, RVWZZ pending, with no electronic signed date or time underneath it, and the recommendations were no additional treatment needed. So how can he be failure to thrive and the instructions are no additional treatment needed? Here is Mindy Schneider, Jason Chapman. Mindy Schneider, social worker, she's stating she had a brief intervention with my son and I on 5/20 of 2013 on a 7/18/2013 medical record. The dates don't match. It's also stating over here that Mindy Schneider did an assessment on September 11th of 2013 that she got the referral from a doctor. And as you can see here, there is a whole bunch of red line markouts, which I've never seen on a medical record before. It is stating the mother recently was diagnosed with CREST syndrome. Mother restricts his gluten, soy, protein, dairy, anything artificial. Mother demanded blood tests for the patient to check to see if he had CREST syndrome. The line that is marked out states, he did not appear as if she was abusive. He appeared fearful for his mother's medical status as well as his own. She, mother, insists the patient has pain after he eats. The mother appears to relate all symptoms, ear pain, abdominal pain, to the food the patient eats. Keith Mann never checked my son in for failure to thrive at Children's Mercy Hospital on March 11th of 2014. As you can see, the admit date was 3/11/2014. The discharge date was 3/15 of 2014. It says visit type inpatient. Keith Mann was the attending physician. But right here, you can see that they didn't check him in because they checked him in to a different hospital. Here it's showing that they're out of all the 1,100 pages that what the hospital actually recommended me to do for my child. And it started in 2012 and ended in 2013 for 1 year. The recommendation was continue a journal of his belly pain, use oil on his in his ears to loosen up the patches. It says we suggest trying adding 1 bottle of Pediasure per day, and it also says no additional treatment needed. So where is it that I didn't follow the instructions? January 30th of 2014, Jason Chapman. He is stating medical child abuse, not medical neglect. The parent is falsifying medical information regarding the child, which results in unnecessary medical procedures. Candace says she has CREST syndrome and no one helped her, so she wants all these procedures and lab work done. I never asked for procedures, as we all know from the advocate phone call that I asked for lab work. It's also stating here not medical neglect. This is from the social paperwork. Now over here on my son's medical record, it says there is documentation from the scan clinic from March 1st of 2014 showing evidence of medical neglect and failure to thrive, and a hotline call was made on me. It's also stating that Dr. Hopkins stated she wasn't familiar with the patient from the scan clinic in regards to Billy's medical neglect and failure to thrive. That's because Dr. Hopkins has never seen my son, and my son has never been in the scan clinic, and neither have I. It's also showing over here, total score of neglect was a 1 on the social paperwork. The abuse score was 0. It's also stating due to neglect. Candace always comes to the hospital crying. It doesn't show that in any of my son's medical records or mine. Tracking since September of 2013, yes, when I got diagnosed, they said they suspect I have a mental illness. Hospital is suspecting Munchausen by proxy because Billy has not gained weight or grown. But over here in the social paperwork, it says that Billy was tall for his age. It says Dr. Page on March 11th of 2014 in the social paperwork is stating that during hospitalization, will we work on refeeding syndrome, reintroduce nutritious foods to his diet to monitor weight gain. Here it says the entry into foster care was his medical examination on March 7th of 2014. It is stating his stomach is hurting. It is stating that he has gastrointestinal pain, and it says see attached growth chart. There is not one. It is stating over here that he's failure to thrive because of gallbladder removal. And it says that I have CREST syndrome, but they just said that I had a mental illness and had Munchausen by proxy. It's also stating that he's a healthy 7-year-old boy with history of failure to thrive. You can see that the social worker name is missing and the date of the examiner's signature is missing. It says that he's a healthy 7-year-old boy, again, with failure to thrive. It's saying that he needs dental evaluation, and my son already had dental evaluation 2 weeks prior to that. March 11th of 2014 through March 15th of 2014, why my son is in state care. This is Children's Mercy Hospital. It's stating that he had no consultations and no procedures done with Dr. Stephanie Page. And as you can see, it says laboratory and they're missing. And the failure to thrive review of systems is actually missing. It's stating over here that he's not cachaic. He's a thin boy, but he's happy and talkative. Cachaic means weight loss, physical wasting of weight of loss and muscle mass due to disease, which my son does not, but they are stating that he has a disease. Right here, it is saying on his adverse reactions underneath and problem list and allergic reactions that the accounts and the admit dates are missing on all of these medical records from Children's Mercy Hospital. A 5-year-old who was brought to the clinic by the mother who stated he has abdominal pain for 6 years. He's been seen by multiple different physicians and multiple different emergency departments, and the only known diagnosis is that he has possible reflux. This is from the Children's Mercy evidence. She states all the doctors she'd been to have not been able to help her or her son. And that statement I have never said to anyone. This was on Dr. Page when my son seen her. So now I know that they went in and they changed my medical records and my son's just by that statement, and that's why I accumulated my records as well as my son's. So here are all my medical records. Here's the social paperwork CD. Here is the CD from transcript from the court, and here is all of the medical records, and here is the medical records that were entered from Children's Mercy. So here you can see that it states capitation claim, the attending physicians are missing, and the procedure codes are missing. It says logistics care solution. So a doctor signed my son up for a non-emergency medical transportation, although I had taken my son back and forth to his medical appointments. It is stating that my son was a temporary patient transfer. So they are using a different hospital stating he was transferred from one to another. So they made all of my son's clinic appointments and the one time he was in the emergency room department into an inpatient stay. It's also stating on these 26 different medical records that it was an internal patient transfer. Here are the same medical records. And as you can see, it says family history not significant. He's 3 years old, but they end up including minor medical complaints, PED, through that application. So they have now entered history of present illness, which obviously he didn't have before. It's showing here that underneath the medication profile at Children's Mercy Hospital orders that it was a duplicate of orders, and then they ended up canceling it. So here underneath medication profile, it says inpatient medications, and it says that the inpatient medication was in 2009. It says medication type inpatient. He was not an inpatient in 2009. It's also stating that the duplicate order matches up to the duplicate order from 2009 while he was in state care in 2014. So it says ordering physician system here, which is not a doctor. They end up canceling the reason duplicate order from 2009. The medication profile, when my son had his tonsils and adenoid surgery done in 2009, it says the medication type was inpatient. And as you can see, it says 2009. It also says that the medication type was an inpatient when he had his ear tube surgery removed in 2012. And it matches over here the medication inpatient from March 13th of 2014 while he was in state care. Dr. Stephanie Page, as you can see, she put that he was medication type inpatient when she unscheduled his appointments under the medication profile. And under his gallbladder surgery, it's also stating he's an inpatient on both of these. This was a clinic visit, and it's stating that he was seen in the emergency department. It says medical record number, then it says FIN number, which is an account number. As you can see, they went up, they changed the medical record number, the account number, to a medical record number. Now it says medical record number, medical record number. Medical record number, medical record number, which they have given him two. So they changed an account to a medical record number. And as you can see here, they forged my signature, and it says mother. So whoever signed this actually signed my signature on this form. Dr. Keith Mann is the one who allegedly put my son into a different hospital, but he was actually in Children's Mercy Hospital. And it's stating that Mara Becker is the one I spoke to allegedly on the phone to get my son's blood test. And they are actually married, despite current weight plotted within normal limits. So they even are stating that his weight was plotted within normal limits while he was in state care. Here it's showing that Dr. Keith Mann's NPI number matches the NPI number up here for the claim type of inpatient. It's also stating that they used an outpatient number for his inpatient stay. And it says surgical modifiers up here. It says the discharge date was actually 3/11 of 2014, but it says through 3/15 of 2014. Right here, it is stating that they used a revenue code of 120. It says 120 Missouri outpatient in 2012, which he was not. And it says for anesthesia. There's over 40 different claims, dental claims from Children's Mercy Hospital paid under anesthesia service. My son has never seen a dentist at Children's Mercy Hospital under the Medicaid management profile. And as you can see here, it says D for dental all the way down. And it says A, anesthesia. And it also has an I here. So from 2009 to 2014, they entered him as an inpatient because it says claims found and it says 2. Then it says other claims 214. So there were his normal claims that they changed over to inpatient stay. Here it says a discharge date of 4/12 of 2011, Brett Ferguson, who is a dentist. It says here that my son was discharged. It says same day surgery, but it was canceled. So why would he have a count if it was canceled and it said he was seen by Brett Ferguson? That same day that they said it was canceled, I found that 4/12/2011 date electronically signed on my son's medical record. That was an April 5th, 2011 medical record. So they electronically signed on 3 different times, a dentist did, on my son's old medical record. And here it says past surgical history, that there were no dental surgeries. Brett Ferguson actually works at Truman Medical Center. So it's stating here Truman Medical Center / pediatric clinic. So now it's stating that my son was transferred from Truman Medical to the pediatric clinic from Children's Mercy. There are 3 different times that they're stating my son was in urgent care, which he was not. And it shows right here on the patient summary that he wasn't even checked in to Children's Mercy Hospital. He was never transferred from one hospital to another in the time that he was in my custody. Here it's showing that the emergency documentation that a nurse actually removed a chart record. It is saying that they went through the complete nursing admission database and his complete history and updated his medication profile while in state care. And it shows that they did it during 2009 because the ordering physician, as you can see, is system. The discharge time at the time of 2009 is incomplete. The anesthesia documentation on when my son was seen on December and January 18th of 2012 and 2013 said he was transferred and discharged, which he was not. It's also showing here that he was an inpatient / outpatient at Truman Medical Center, which he was not on the billing. It's stating here that Children's Mercy Hospital saw my son for a mucoid on his mouth, and it says small fluid cyst on his lip. This should resolve on its own, as we discussed. Thank you for bringing Billy to be seen at the Northland Urgent Care. And it says with unknown PC. It doesn't say anything about Truman or he was transferred from one hospital to another. So when I collected his medical records from Truman Medical Center, it is stating that there are 13 files on this disk. And as you can see, it says application extensions. So that means that the records that were entered into court, the application extension, actually came from Truman Medical Center, that those records didn't even come from Children's Mercy Hospital. They came from Truman Medical, and they were made in order to enter into court. It is also showing on Truman Medical Center that my son was seen at Hospital Hill, although it's stating that he was seen on Charlotte Street, which he was not. It is stating down here that the time was CST time, but up here it says CDT time. These are two different medical records from my son's Truman Medical Center Hospital. He was seen twice. Here it is showing on September 16th of 2010, and it was printed for me on February 7th of 2018. That, as you can see at the bottom here, that it says the ID number matches up to the printed requested ID number from Children's Mercy Hospital, because down here it says a copy. And it says tentative discharge date was 3/15 of 2014 while he was in state care. It's also showing that the responsible provider is missing on all the records from Truman Medical Center. Here it says system, which matches up to the system from the records that were entered into court from Children's Mercy. It's also stating that on all of these, that the consulting physician is missing on all the orders from Truman Medical. It's also stating in the medical record that he was supposed to have his treatment done at Children's Mercy, and I didn't show up, which is a fabricated statement. And as you can see, the administrative is missing its documentation. Over here, it is stating that my son was seen on February 11th of 2011, and the mucoid was removed from his mouth. But it's stating here and that the outside documentation from that appointment is missing. This is the consent form from Truman Medical Center. As you can see that the physician is the same physician, but the signatures look different. There's missing date and times on these consent forms, and the witness didn't date it. And my signature is on this forged consent form, which I've never seen before. Here it is stating that I left without signing, and there's a missing date, but they went ahead and dated it. I've never seen these two documents before. This is stating that I give consent for an inpatient admission. My son was not an inpatient at Truman Medical Center, although it states on the billing that he was. My son was never an inpatient at Truman, but he was an inpatient at Children's Mercy Hospital, but Keith Mann didn't check him in for an inpatient. He checked him in to Truman Medical Center. As you can see here, this came from Truman Medical Center with my signature not on it, and it was printed, and it says Children's Mercy Northland Urgent Care, although the medical record at the bottom is Children's Mercy medical record number. So now there is two different patient labels with two different dates on them that don't even match the date of my signature. And this is a blank emergency documentation. So now they're blank. They forged my signature on here. So now they're stating he was transferred, but the dates don't match up from Truman to Children's Mercy. So this means that this document was not, that was entered into court, was actually printed from Truman Medical Center. This is a hospital patient face sheet from Children's Mercy Hospital. And it's saying that there were 3 referrals while my son was in state care, and it says 36-hour DFS, pre-clinic. But we know that the pre-clinic was March 1st of 2014, which was a no-show. That's not even the time that my son was an inpatient. Up here, they forged my mom's signature here. There's not even a date or time that my son was entered for overnight stay and checked in at Children's Mercy Hospital. Here are the capitation claims. As you can see, all the attending physicians are missing and all the procedure codes are missing. This is claim type outpatient that they changed now over to a different claim. To all of these say that my son was an inpatient. All the claims say that it was 0, except for there was one claim paid on it for inpatient, which was rheumatology. This is stating the capitation number under the drug claim type, and it says that it was edited over here, the capitation claim. But the edits actually come from my medical record from KU Medical Center. So they used my medical record to actually do change my son's medical records. Right here it is stating that on 3/10 of 2014 that they gave my son the same medication for his stomach 5 different times. And it's showing here that the order type was a pharmacy, but the action date was actually when he went as an inpatient. So they drugged him up while he was an inpatient so he wouldn't state that his stomach hurt. On March 18th, Children's Mercy Hospital, the onset of symptoms. Recently hospitalized for concerns of weight gain. So now they're saying that he was hospitalized for concerns of weight gain. But before they said it was weight loss. But it says weight gain right here in his medical record. Since his diet was restricted before, he may have some stomach upset from new foods introduced into his diet. That doesn't even make any sense. And you can see here on March 18th of 2014 that he wasn't even checked into the hospital. They checked him in to Truman. Here it is stating that he was an outpatient, but there's no number because this says outpatient year, outpatient number, so they can actually just change it to an outpatient so you don't even know what year it is. So it's missing on there. But on that day, you could see it says under the medication administration record that he was given a drug under medications. Then they changed that medication type to inpatient on March 18th of 2014 when he wasn't even an inpatient on that day. Inpatient discharge signature page on 11/19 of 2009 medical record. As you can see, it says signature page, patient copy and chart copy. They're both blank. And then over here, they forged my signature on it and it says today's date, November 19th of 2006. It's the wrong date. And this says 2009. It is stating that Dr. Page's signature she is inpatient in 2009. So now it says discharge signature page was on March 15th of 2014. So we actually know who made the CD was Dr. Stephanie Page. It's also stating here that the discharge instructions says inpatient on all 3 of these. From 2009, 2012, and 2013 when he had his surgeries, but my son was not an inpatient on those dates. It's stating that Billy was never seen at the University of Kansas Hospital. He was seen in the clinic. Now they're stating that my son's medical record number is here, but when I got his medical record, it is a different number. My son was never seen at this hospital. He was seen at the KU Midwest, which is a clinic on Renner Road. They're stating that they cannot find, through an email, that they cannot find my son's clinic medical records. These are the medical records that were found at Children's Mercy that were entered into court. And it says KU Midwest, Renner Road. These medical records that were entered into court, it has a doctor's signature and the date is missing. These medical records don't match up to the medical records that I received. So now here's Children's Mercy record, and it says that he's been evaluated at KU Midwest by Dr. Wakefield for recurrent ear infections. He had tubes entered and he began having recurrent ear infections every 2 weeks from one ear to another. He snores most nights, irregular respirations, and has chokes on food and shortness of breath, nasal congestion, and 1 episode of vomiting, which she never even said that he, after giving those diagnoses, that he should be tested for food allergy. It's stating over here that he may benefit from having his tonsils and adenoids removed, but it also, as you can see, it's all choppy here. So they added, I think we should also replace his ear tubes. That's because they never got consent to do it. And she told me after she did it, and I didn't want him to have a second set of tubes in his ears. Here it states that the patient indicates on my son's medical record, which has 5 different encounter dates, although he was only seen twice, that he indicates that I have a history of anxiety and depression. Although it states right here, he is sucking on a pacifier, he is largely nonverbal in the office today. Here is my medical records from the University of Kansas Hospital. Here's my son's medical records from the University of Kansas Hospital. It is stating that he had his surgery done at the main campus, which he did not, and he was not in observation on that day, which they have changed. It's also stating that they added a medication to my medication profile, amoxicillin, which I cannot take. So they went back in and added a new medication to my medication profile. Here it's stating that my son was seen on a progress note on February 8th of 2011. There's no way that my son had this date that he was seen because the doctor had moved, and it states that she had moved on August 1st of 2010. My son was never seen in 2011 because that doctor was already in clinic in New York. The order name underneath Children's Mercy medical records, it says on February 21st of 2011 that there was an office level visit. And as you can see, it says office level visit, but then it says Northland Urgent Care. So they have changed an office level visit to an urgent care. On that same day, they didn't check him in. That same office level visit I found at the University of Kansas Physicians, the office level visit 3. The billing, you can always tell what they did in the billing, and that's how hospitals get caught, because if you go through the billing, you can see exactly what they did and how they changed your records. So as you can see, there's the second page is missing of my son's billing from the University of Kansas. They even have a different medical record number underneath. And here is the third page. The page 1 is now the third page, so there's 2 pages missing. That office level visit came from Children's Mercy Hospital, because right here, that date, it's showing that underneath the capitation claim, it comes from Children's Mercy Hospital, and they modified it. The University of Kansas Hospital and my medical records, it is stating that I filled out a patient summary of what my symptoms were, and it's showing that I had a heart attack, which I don't, and I don't have headaches. It's stating I have anxiety, which I've never been diagnosed with. It's also stating that I was seen in the emergency room on the day that I had just my tonsils removed, and on the patient label, there's a missing date of service, and there's a blank admission record on here. It's also stating that I have Medicare, which I did not. I now, at St. Luke's Hospital, am showing that I have seen David E. Wilson was my doctor. It is showing here that they changed at St. Luke's Hospital my doctor to David B. Wilson. It's showing here that I got cut on my right finger. It is stating that I was seen in the Department of Cardiology, which I was not. And as you can see here, that's my forged signature, and the phone number is missing, and there's no date or time on the patient label. Over here is now a medical documentation stating that my primary care physician is David B. Wilson when it's David E. Wilson. It's also stating that my past medical history is just redness in my nose, which I have been to St. Luke's Hospital since birth with abdominal pain. It is stating here that my mother's alive and that my father's alive with some heart stuff, although my father passed many years prior to this document being made. It's saying that I had nausea and abdominal pain, which is likely from post-surgery from my tonsils and adenoids being removed, which I didn't have my adenoids removed, it was only my tonsils. And it's also stating that it was done at 23:59 right before midnight. My dad was deceased at this time. I would have never told the hospital that he had heart stuff because he died of a stomach aneurysm. Here it's stating that David B. Wilson is actually a doctor at the University of Kansas Medical Center. So they changed my primary care doctor to the cardiology department at the University of Kansas Medical Center. The University of Kansas Hospital, here's my medical record number and how they changed it to a different medical record number. And it says the hospital account was 2359. It's also stating that I was seen in the emergency room department, but it's missing the date. It's stating that I have anxiety, I had a heart attack, which I've never had. And it says that they note twice here that there was an exclamation point that wasn't the result, that wasn't dispersed into the flow sheet, and there's missing labs on both of this documentation. Here it's showing that I have not one, but two, but three different kind of patient labels for one hospital that I was seen for 5 hours. And as you can see that these are blank, and then here is my signature on here, and I've never seen these consent forms before. Over here, it is showing that they forged my consent form on saying that I authorized payment for my inpatient stay, and it says to the University of Kansas Hospital. So now they have now said that I was transferred from my inpatient stay from when I got sick, and they're trying to cover themselves at the University of Kansas Hospital with St. Luke's Hospital. So here are the blank authorization forms that I received off of Children's Mercy Hospital website. And as you can see, there's no lines in the middle of them, squiggly lines. So here are all the blank ones from Children's Mercy as well. And then here becomes my signature on them. Here is a squiggly line, and I have never seen the portion of this top part before. There is 1, 2, 3 different bottom half of these. And it's stating that I give consent for dental treatment, which I have never seen these forms before. It's also showing here, there's my signature, and here is a darker of the relationship to patient, which should say mother, and they went ahead and implemented my signature again because you can see it's darker, and then the dates are missing. March 11th of 2014, inpatient stay. Grandma cannot provide medical consent but can sign for the discharge. Mom is not to receive any information. Grandmother states the patient was taken into custody because of abuse, with a double period at the end of the sentence, meaning that they went ahead and implemented that after the record was made. Grandmother stated that provider was supposed to prescribe medication, which she didn't make that statement, and it also stated that the grandmother requested on admit. That was a false statement as well. And as you can see here, here's a squiggly line. There's my mother's signature, and they stated up here that the grandmother can't provide medical consent, but they have my mom's signature that they forged on a consent form to go into the medication history database and the Medicare benefits for an inpatient stay. Patient is at nutritional risk due to failure to thrive. Children's Mercy Hospital. About 9 months ago, patient had more abdominal complaints after eating some foods, and gradually meal selection had been more restricted since. Grandma said that the patient will have upset stomach for 60 minutes, and the mom would give a medication sometimes to relieve the pain, but it's not good to give medication all the time, Grandma said. Well, that just counteracts when they said that she asked for a prescription. This registered dietitian turned to Billy and asked him to describe his experience. Sometimes it's right here on my stomach, sometimes it's all over my belly, sometimes it goes away automatically. So Grandma raised the question to the registered dietitian, you mean that you don't recommend organic foods? The registered dietitian responded that organic foods are foods that contain organic ingredients do not necessarily mean it's a healthier alternative. Here are identical stickers here on my mom's forged consent, and you can see that they don't even have a date or time on the patient sticker while my son's an inpatient. You can see here that it's blank, and then here's my mother's signature here. Here is a squiggly line. Here's a squiggly line here that they stated that my mom doesn't have any consent. So why did they put a patient account here with no date on it, and it wasn't printed from the computer? That's because it came from Truman Medical. Jason asked Billy if he eats other things that aren't on his diet when he's with his dad. This is when this social worker is interrogating my son. He stated that he doesn't change his diet, but his dad eats other things, and it doesn't bother him. Billy stated that he never feels hungry and that the only time he feels tired is when he eats sugar. Jason then asked Billy if he's taking any medication, and Billy stated that he's not because it upsets his stomach. Jason asked Billy if he felt safe at home with his mom, and he stated that he does because she takes care of him and helps him with his stomach problems. Billy then stated to me that before he changed his diet, he was always hungrier and that he would just keep eating things that hurt his stomach. Mindy Schneider stated that there were concerns that Ms. Schwalm has falsified information regarding her son. Now, this is the social paperwork. There has been 3 era of complaints regarding Ms. Schwalm towards Billy. First, the ear complaints, which the hospital does believe that Billy had, but Ms. Schwalm pushed it further. By the end, she had placed his tubes in his ears, paper patches, and his tonsils and adenoids removed. The second complaint, Billy's only gained 2 pounds in 2 years. Ms. Schneider stated that this is believed to be directly connected with Billy's restrictive diet. Mother requested a very specific scan. Hospital refused, stating it's not necessary. The test came back normal. The mother wanted Billy to have his gallbladder removed, and she was informed it wasn't necessary. She pushed the issue, makes an appointment with the surgery, and it was removed. The third complaint, Ms. Schwalm claimed to have Crest syndrome, which she requested Billy regarding the disease. This began in August of 2013. Tests were conducted, nothing was positive. When asked by medical professionals if she could produce documentation that she was affected by these diseases, Ms. Schwam claims to have them, but would never let the staff view it. Over here, it is stating in my son's medical record in the rheumatology clinic that she showed me one of her lab result sheets that she had a positive anthracentamide B antibody. So that is a false statement. I did let the staff view it. Ms. Schneider stated that the medical staff will not do any more labs or surgeries moving forward, which is a lie. They did it while he was an inpatient. She doesn't want to deal with any more doctors and feels she should not have to do anything simply because she doesn't want to give her son foods that make him feel sick. Perhaps we could arrange a different doctor or hospital to see her son. They never offered that to me. Ms. Schwam stated this whole process has been hard on her health and her son's health, and she would appreciate not having to meet with anyone further unless absolutely necessary. Ms. Schneider stated that currently Ms. Schwam is declining to take the child back to Children's Mercy. And because I did that, they now went ahead and referred it to the juvenile office. Now, on September 30th of 2014, it said the chief complaint at the rheumatology department that the maternal concern was for autoimmune disease, that regarding the chronic abdominal pain. And she states that he refrains from just eating dairy, gluten, and corn. It's also stating that his history of physical exam are not concerning for systemic autoimmune disease. And it's stating here, though, while he's in state care, that they acknowledge a disease process. Here it is showing that while he's an inpatient on 3/14 of 2014 at 9:20, that they updated my son's medical records on 9/20, the rheumatology, because it says the communication type is not available. So what they did is they updated his inpatient stay to the rheumatology department, and then that's when they started doing all the testing for scleroderma on him. So it states here that his skin integrity, skin and risk assessment was done on March 11th through the 15th of 2014. And as you can see, it says skin integrity risk assessment on all of these while he's in state care. So over here, it shows how that they actually put it back in an old record on 11/19 of 2009 because it says skin breakdown. Here it's stating that the respiratory care plan was done at 1304 in 2009. And in 1304 time, Dr. Stephanie Page, and it states Dr. Stephanie Page went in to the medication profile on the time of 1304 and then did his respiratory care plan. Here it says neurological, they checked his facial symmetry, and it states neuromuscular assessment that they did. And as you can see, this was done while he was an inpatient, and it says on March 11th through the 15th of 2014, but it says that they actually checked his facial symmetry on 12/18 of 2012. They did a vascular pain score while my son was an inpatient. It says March 11th, 2014 to March 15th of 2014, but it states that they actually did that vascular access through my son's gallbladder surgery. And it says overall vascular score was a 7, and that says rheumatology outcome. This is the transcript from family court. This is my state attorney stating, aren't there undiagnosed diseases, asking the child abuse expert. She says, yes, major medical condition. She said, yes, continuous intestinal pain that can include vomiting and diarrhea frequently. She said, yes. And so Chris syndrome, it's an autoimmune disease, she's explaining, that is under the subheading of scleroderma. It's a connective tissues of the body, and your skin can be tightened, and GI issues. And she also expressed, according to the medical records, that she felt that this boy also had Chris syndrome because they both had pain after they eat. Is that correct? She says yes. Did she continue to report that the boy had many problems from food and digestion? And when the child was in the hospital, were any of these problems ever observed? He did well in the hospital. So they said no, because they had him on drugs. Here is the actual effects of scleroderma. It's too much for me to go over right now, but it affects much more than what the child abuse expert leads to believe. My son is 3 years old. It's stating that they gave him an ASA score of 2. It's also stating here that the patient has a chronic illness at 3 years old. I did not fill this out. As you can see, someone went over and refilled this document out because it also says, does the patient eat baby food? And someone put yes. but my son was 5 years old and I would not have put yes because it says baby food, but it says goldfish, pineapple, milk, and apple. It's also stating that the ASA2 diagnosis is a mild and moderate systemic disease. They never told me at that time that he had a moderate, mild systemic disease at 3 years old. This is a conversation that I had on August 15th of 2013 with Dr. Page. It says, mom wanting testing done to see what autoimmune he has so she can help him more. Calling about getting some tests done, and she has some questions. Dr. Page stating, I'm not aware of any autoimmune issues with him. It says, Dr. Page stated that the mom seems convinced that the patient's problems stem from multiple food allergies. Now, as you can see here, it says addendums through here. That means that they went and changed the medical records at that time. Maybe not on that date, but that time. I did not have this conversation starting in August because I did not get diagnosed to see if he had any autoimmune issues or testing done until September. So it says allergy, the continuing of this conversation, it says allergy testing appears entirely negative. Mom's concerned the patient has an autoimmune problem. Billy may have food intolerance, but there's no way to test for that. Mom wonders if she passed something on to him. Then Dr. Page states that his PCP can order any labs if worried about lupus or immune deficiency. I don't typically order those tests, and I don't want to order the wrong one. Then she states in the conversation, I could scope him to see if there's any food allergies that don't show up on blood work. And she states again that I'm not interested in having the patient re-scoped. Well, see, that's because she scoped him while he was an inpatient and didn't tell the family that he was actually scoped. They withheld the medical information of what they did actually while my son was an inpatient. So she said that she doesn't order any kind of immune test, but it shows right here Dr. Stephanie Page ordered his IgA level, which we know is low. It's also stating here that the encounter information was done on 10/29 of 2012, but she's stating she had the conversation with me on August 14th of 2013. So she went back to cover herself up and made the encounter info on a different date. It's also showing here that she's stating that my son visit record on 10/29 of 2012 that he was a new patient, which he was not. It's stating here, Dr. Page on October 24th of 2012, 5-year-old boy with chronic abdominal appears to be gaining weight appropriately. Per mom, he's had a well-balanced diet but continues to complain of abdominal pain every time after he eats. Billy is here in clinic for a follow-up of his abdominal pain. Mother brought journal today, which includes descriptions of his diet and complaints of abdominal pain. Mother took pictures of stools and offered to share them. Mom volunteers at school on Wednesday morning, and the teacher came up to her and reported that Billy told her that he had some belly pain. Typically, Billy will complain of belly pain after meals. October 29th of 2012. Pain occurs in the periumbilical location as well as the left lower quadrant. He describes it as an irritating kind of pain. Mom does feel it gets worse by eating certain foods. Billy reports some symptoms consistent with nausea and bloating. Significant for poor sleeping, excessive appetite, having energy but looking tired. Swelling under his eyes, cough and wheezing. Billy has not been in the hospital overnight. Significant for mom having bowel issues her whole life. October 3rd of 2013. They're stating that all the doctors she has seen have not been able to help her son. Multiple GI issues, the mother. Mother and child do not describe the pain very well, just state he has consistent abdominal pain. Well, it stated that he said that it was after he was eating. So he did describe what the pain was like. Now she's trying to blame us because we don't describe the pain very well. It's also stating in the medical record that he appears to be growing well and gaining weight. And at the time, the patient appears to be healthy and no distress. It says that encourage mother to return to the same physician for better continuity and that I have good return precautions. So I'm going to the same physician and I have good return precautions means I don't have Muschenhausen. Appropriate growth for age on October 3rd of 2012. On this same date, it's stating that he had a temporary patient transfer, an internal patient transfer. This is stating on January 4th of 2013 that Dr. Page ordered a gallbladder scan. It's stating that she used an Action Personnel contributor system. It's also stating that that contributor system was implemented in my son's medical record on 3/11 of 2014 while he was an inpatient. And that was Dr. Stephanie Page, who ordered this exam. So this means that she used that as the image name to go in to change my son's medical records. The same accession number that's found on St. Luke's is the same accession number that was found on Dr. Stephanie Page's abdominal complete scan. And it says dictated by contributor system. On that day, the diagnosis is missing as well. Here it's stating that Dr. Page on 1/4/2013, she ordered for my son to have his gallbladder scanned. It's stating that he watched a movie during the exam, but now it's stating that he was under sedation. It's also showing that she unscheduled the times that she saw him while during he was an inpatient. On all of these records, the orders are stating that they're pre-processing scripts. They're from a default account. And it says hold until collected. It says yes. And then it says time changed allowed yes. So now I've realized that they can actually change the time to separate medical records and to change them. Because right here when my son was seen at Children's Mercy for his surgeries, it is stating that it was all done in CST time. But when my son went in for state care, it was all time in CDT time from March 11th through March 15th of 2014. It's also stating she put him as a new patient and they use some kind of scale B ID. And it's also showing here that the patient ID that you must check the second one. It's also stating that when my son had his gallbladder removed, that they did a immune test on him, which they did not, which is a lab work. It's showing over here that Mara Becker allegedly ordered that centromere antibodies test, but it's stating that Dr. Page ordered that test, that she went back in and changed it because it says Action Personnel System, that she modified it. It says that my son had a referral of a different information of insurance on a 2/6/2000 record that doesn't match this 1/21 of 2013. It's stating here, the course on October 3rd of 2012, on January 15th of 2014, and on March 7th of 2014 when he's in state care, that there is a progressing as expected disease. She states, the day after they remove him from my custody, on March 6th, my mother takes him to the doctor. And she states that it was nice to meet Billy today. He looks good. He should limit spicy, greasy, and fatty foods as this makes reflux worse. His tonsils and adenoids were normal at St. Luke's, that he had chronic ear infections. His tonsils and adenoids were normal at North Kansas City Hospital, that his tonsils and adenoids were normal when he saw the doctor in Liberty. And the doctor in Liberty, Dr. Rouse, said, unfortunately, it's quite a difficult case as it's hard to tell why the child's uncomfortable. We will try Zyrtec as well as adding Prevacid to see if we can decrease the inflammation around the eustachian tube, as this could be causing some of his discomfort. But again, without drainage, I don't know why he's having pain. So there was actually 7 to 8 ENT doctors that couldn't figure out why he kept having chronic ear infections. Here it's stating on November 19th of 2009, Dr. Tamika Wakefield, my son's 3 years old. It says, chronic tonsillitis and disordered breathing related to sleep. He was evaluated in the ENT and surgical intervention was recommended. So they recommend surgical intervention. So if you don't do it, it's damned if you do, damned if you don't. So it's saying that surgical intervention was recommended. So why are they trying to blame me for the ears? So here it is stating that based on today's assessment that Dr. Daniel Brugger recommended scheduling patient for the removal of the second set of tubes that I did not give consent to, which he said that needed paper patches. You would not know that until you went in to actually do the surgery, because after they were trying to cover themselves up. It says, per operative note, his left tube was more difficult to remove and left behind a 40% hole requiring a large paper patch because that it was hard to remove the tube. He needed a paper patch. That's why, not because I said that he needed a paper patch. And it also states here when he had his tonsils and adenoids removed November 19th of 2009 that the case was an inpatient case with the signature missing and no date. Right here it states that Dr. Wakefield changed the order of ear examination under anesthesia to add replacement of ear tubes. As you can see, it is showing that my son under tonsils and adenoids, that he had that surgery right here under the orders, but someone went in system, and as you can see, the action personnel, which is not a doctor or nurse, they went in and changed that they put replacement of ear tubes under anesthesia, but they never told me about that. So they ended up changing and modifying the order of just the tonsil and adenoid surgery to ear examination under anesthesia. Here is Dr. Paul Dowling. He is an immunologist, and my son went there on June 5th of 2011, stating that his skin was itching and he had nasal sneezing, itching, and redness in his nose, and occasional itching of his eyes. So he told me that it could probably be environmental allergies, but it states that he had it when he would eat mango, and it also occurs without mango at times. So then he said it was after indigestion of food, but he said there was no concern for food allergy. Here it's stating that my son was diagnosed with expressive language. It says over here on November 19th of 2009 that he speaks in short, clear sentences, but very reserved around healthcare provider, and that the Children's Mercy Hospital was the South Campus that Dr. Tamika Wakefield did his tonsils and adenoid surgery. The transcript from family court. Okay, Dr. St. Peter's surgery was successful, wasn't it? Meaning the removal of the gallbladder. It removed a chronic problem that Billy was having, a problem that he'd had long term. He removed his gallbladder, but it didn't relieve his pain. It did for a time. Briefly it did, but he was complaining of pain again within a couple of months. So it's stating that he was complaining, it wasn't me. Could cause rupture of the gallbladder, unlikely. Could cause other serious complications that could affect his entire gastrointestinal system. It could cause complications. It could cause death, couldn't it? Highly unlikely. And then my attorney said it could, and she goes, So it's a possibility, and Dr. St. Peter could have saved Billy's life that day, couldn't he have? The fact that Ms. Schwam took Billy to the surgery clinic and with Dr. St. Peter's help figured out what was wrong with him upset the other doctors at the hospital, didn't it? And when Ms. Schwam took Billy to the surgery clinic, yes, to see Dr. St. Peter, he had a diagnosis for Billy, didn't he? And then the child abuse expert, Dr. Kylo, says, I wrote that in my document. Okay, but you didn't, because they were trying to blame me for the gallbladder removal. And the diagnosis after looking at Billy's gallbladder is that he suffered chronic inflammation of the gallbladder. Inflammation of the gallbladder, correct, chronic. What does chronic mean? That means more than just normal. So he suffered this condition for quite a while. Yes, he could have, yes. Okay, so it's possible that his mother wasn't making up symptoms when she was telling the abdominal pain? Right. And I reviewed that and going into this document. So here we have on a 2/6/2013 document, medical record, that it says up here 1/8/2013. These don't match, and it says under sedation, and my son wasn't under sedation on either of these days. It says spoke with the mom who was unaware of a EGD or a colonoscopy had been ordered. Instead, mom wanted the number to the surgery clinic and was planning to call to speak with someone there about having the patient evaluated for the gallbladder removal. The nurse provided mom with the number to the surgery clinic at her request. Mom is not aware of tentative date with some doctor named Dr. Attard, which I've never heard of before. And it says the tentative date was 1/31/2013. So none of these dates match up. He wasn't sedated on these days. And if they knew that I was going to go have the patient evaluated, why are they trying to say now that I had the gallbladder removed without a doctor doing it? So Dr. St. Peter, January 10th, 2013 clinic visit. He's been put on reflux medications, relaxing medications, and stimulating medications, and nothing has really affected his symptoms. He has got pain in the upper right quadrant, and he did have a HITA scan, which shows an ejection fraction of 36%, which is on the fringe of normal. He does have an ejection fraction that approaches abnormal. Having no luck with upper GI medical management, I think it's reasonable to go ahead and plan to remove the gallbladder. Physical examination. He does have tenderness in the right upper quadrant compared to the left. In summary, he's a healthy young man who developed pretty severe GI symptoms. These were occurring after meals. So this is probably the fourth or fifth doctor who knows that it's occurring after meals. Billy is a 6-year-old boy who has a history of gallbladder pain. The cystic duct was dissected out. The gallbladder surgery. Here is when my son went to go get his HIT scan. This is when he had the gallbladder removed. This is what his gallbladder looked like with that bile stain on it, and the cystic duct was dissected out. Dr. St.Peter removed my son's gallbladder on January 18th of 2013. The HIT scan was 36%, which is the fridge of abnormal. It was bile stained, the gallbladder, as you can see in the picture. The cystic duct was dissected out. Dr. Stephanie Page didn't refer to surgery based on the test that she ordered or for an evaluation. Ms. Schwam took Dr. Page's result to Dr. St. Peter with different results. So here you can see that it says max 5 days of therapy. It says inpatient medication. This says inpatient on January 18th of 2013, which my son was not an inpatient, and it says at 1 o'clock in the morning. It's also stating over here in the orders that they ordered max 5 days of therapy underneath when he had his gallbladder removed, when he was an inpatient, not when he had his gallbladder removed. Dr. Dinakar, evaluation of food allergies. Taking away wheat, corn, and other dietary changes has impacted him positively in terms of GI reflux, abdominal pain. June 6 of 2013. He's been seen by Dr. Page. Billy has abdominal pain and GI issues for many years. Mother's made many alterations in his diet, and she feels it has been helpful to discontinue gluten, corn, red meat, and dairy. Mother has done extensive research on food allergies and digestive issues in general and is well informed. And at that time, a dietitian was in there and stated that they needed to obtain the patient's nutritional status. The results came back that his white cell count and differential electrolytes and kidney function are within normal limits. But right here is when they tested my son for food allergies, and as you can see right here, the square that was supposed to be filled in for peanut was not. He was not tested in the allergy clinic for a peanut allergy. This actual medical record I have is an original. It was not found to be put in the CD that was entered into court. Right here it shows that the claim type was outpatient on the Medicaid, but they changed when my son saw the immunologist allergy clinic into an inpatient. Mother suggested that the child may have a food allergy. All right. Transcript. For example, at one point, did the mother indicate that she felt that the child had some type of autoimmune disease? Correct. Was there a request by the mother to have tests performed in regard to that? Yes. Were any of the tests performed? She said no. The child abuse expert, Dr. Kyla. Now, on the other side of the coin, at one point, did the mother suggest that the child might have some type of food allergy? Yes. And were tests performed to determine whether or not there was any food allergies? Yes. And what were the results? The tests were all negative for food allergies. So right here, it is stating that on March 13th of 2014, during my son's inpatient stay, he ate a peanut butter sandwich. Over here on that same day, it is stating that my son was injected with an EpiPen for anaphylactic. That his inpatient stay was November 19th of 2009, although it was March 11th through the 15th of 2014. And here are the nursing records, and it says that the institution of where my son was seen is missing. My son had surgery. The mother shared her medical history with doctors when she was consulting for her son. So as a part of the medical history, again, providers would ask about the mother's medical history. And she did share diagnosis and medical problems that she has part of her medical history. And that was documented in the records, yes. Isn't it important for the family history to get family history? Correct. And yes, that was done per standard. Transcript from family court. My attorney. The mother shared her medical history with doctors when she was consulting for her son. So the witness, as a part of the past medical history, again, providers would ask about the mother's medical history, and she did share diagnoses and medical problems. Not one doctor from Children's Mercy Hospital ever asked me to share my medical diagnosis. I actually told them that I got diagnosed in September with scleroderma. And when the mother came in September stating that she had recently been diagnosed with CREST syndrome, the witness said, sorry, yes, okay. Isn't it normal that children inherit diseases from their parents have sometimes? The question, my attorney, again, undiagnosed diseases? She says, I mean, that is very general, but yes, a disease could potentially cause other things, yes. So a disease could cause issues and it's not the food. Over here at St. Luke's Northland Hospital, it says surgery department, and it says this is an anesthesia record. It's also saying that I have an ASA2, which is a systemic autoimmune disease, which they never told me that I had at that time in 2004. It's also showing over here at St. Luke's Northland Hospital that I have CREST syndrome, scleroderma, on a physician record that has no date or time or service on it, even on the patient labels. From the Center of Rheumatic Disease from St. Luke's Hospital, Dr. Kent Houston. I asked on February 8th of 2018 if they could send my medical record. And as you can see, the information at the bottom is missing, which is my name and date of birth and the date that I had my clinic visit. Over here, I had it resent on July 24th of 2018, and now my name and the date of January 14th of 2014 when I was seen is on here, and my birthday. They also included progress notes. Down here on the progress note, it's stating that I said that I need help and that just all the doctors think I'm crazy. This same sentence was put over in my son's medical record at Children's Mercy Hospital, stating all the doctors she has seen just think she's crazy. I have never said this before. It's also stating that my son was seen on January 15th of 2014 at Children's Mercy and saw a Casey Williaman on this day. It's also showing on the CD that was entered into court that on the same day on January 15th of 2014 that now the doctor is missing. This is, says that my name is Candace L.H. Schwam, that my son was under anesthesia, which he was not at St. Luke's Hospital. It's stating that it's a third-party access account balance of 0, and it says total charges and total payments are 0 over here, which matches up to Children's Mercy Medicaid. It is stating that I was tested for ANA antibodies, and this is my medical record number, and it's stating up here that my name is Candace L.H. Schwam at St. Luke's Hospital. It's also stating at St. Luke's Hospital on another record that a different doctor had an ANA antibodies done for me. And I have now 2 specimen IDs when I would only have 1. This specimen ID time matches up to my son's specimen ID time on his medical record. It's showing that my name is Candace L.H. Schwam on this record, and my name over here is Candace L. Schwam. It's now showing at St. Luke's Healthcare System that I have 4 different medical record numbers. It is showing here that in 2004, I was diagnosed with interstitial cystitis and endometriosis. It's also stating that my date of service was on March 1st of 2014 at 5:39 p.m. But down here, it is showing that it was on of 2004. And these medical record numbers don't match on my medical record number. Here it is stating at the University of Kansas Hospital on May 8th of 2010 that I saw Dr. Keith Sale. It is stating up here that there's an exclamation point that indicates a result that was not dispersed into the flow sheet. And it says it 2 times. So they're saying that there was a result that was not dispersed into the flow sheet. And there's an exclamation point. So the exclamation point is over here at St. Luke's Healthcare System. This is a 2010 record. This is a 2014 record. What the University of Kansas Hospital was doing is they used my ANA antibodies for scleroderma, and they went back in to their system and diagnosed me previously in 2010, even though I was diagnosed in 2014. St. Luke's Hospital forged and falsified my signature. There's no date or time on any admit stickers or on these consent forms. And as you can see, the stickers up here were supposed to be down here where the patient label is supposed to be. There is no date or time on any of the patient labels from the healthcare system, from St. Luke's Hospital, and there's also a date that's missing at the bottom of this consent form. This is showing that the consent forms have a dot at the top of them, these holes, and as you can see, someone put a prescription pad over it. I've never seen this done at a hospital before, and I'm wondering why they put a prescription pad over a consent form, and then they stamped void all over it, and it says poor original. And it says that the physician was Dr. Dunn, and I've never seen a Dr. Dunn before. December 7th of 2016, the Office of Child Advocate in Jefferson City reviewed my case. She stated, I noted that the monthly summaries on the case were somewhat inconsistent regarding actual placement of the child, and placement screens were not properly updated to reflect the child's inpatient stay at the hospital at the beginning of the case, or the placement change. No contact information was made to detail the case closing, and there's no closing summary. The 10 common healthcare provider ways that they can do fraud is misrepresenting dates of service, misrepresenting locations of service, misrepresenting provider of service, and false and unnecessary issuing of prescription drugs. That's what I found in my medical records. They falsified legal medical records at these different locations for my son. And the symptoms that my son has to face every day causes problems and risk factors for his body that he can't control. Dr. Stephanie Page, a gastroenterologist at Children's Mercy Hospital in Kansas City, Missouri, did not feel it was necessary to uphold specific ethical standards that are required legally by law, punishing and discrediting a mother's love for her child and herself when there was never a plan of care initiated nor a diagnosis given. The medical oath is to do no harm. Harm is the only result that my family has received from these organizations and doctors. Separating a child from their mother has devastating effects. A child developing a healthy mental and physical well-being depends on a mother and responsible healthcare professionals, which my son has yet to receive. I hope this video was informative, and thank you for watching, and I dedicate it to my son, Billy Barami.